Looking now at bridges specifically, there's going to be different types of bridges. These here that you're seeing right now are considered traditional or conventional because they consist of abutments and pontics. In this one here, we can see that it's consisting of 3 units, 1, 2, 3. We have our 2 abutment teeth here on either side with our pontic going to be here in the middle. And this would be a bridge on natural teeth because we prepare these natural teeth to accommodate something to fit over the top of them and allowing for this tooth between them to be replaced. On this side, we have what would be considered a bridge on implants. And here we have a 4-unit bridge. We have 1, 2, 3, 4 components to this bridge. And you might be thinking, well, why are they doing a 4-unit bridge when it looks like here on this side are 2 pontics, or 2 abutments, sorry, these are abutments. The pontic here, and then only 1 abutment here on this end. Well, as you can see, this is replacing second, first molar, and second and first premolar. So the reason why they opted to do a 4-unit bridge with 2 abutments on this side of the pontic is 1, because we're not going to put a crown or create a bridge that's going to attach to a third molar, a wisdom tooth. So we wouldn't be able to do an abutment here. But when we're talking about posterior teeth, again, we do all of our chewing on our posterior teeth. So whatever we're putting into the mouth, especially a fixed prosthesis, we want to make sure that it's going to last a long time. Had a 3-unit bridge been done on the posterior teeth, because of the patient and the way they're going to be biting and chewing, and maybe this patient provides a lot of torque and pressure on the posterior teeth, that they wanted to make this bridge a little bit stronger, which is why they opted to do the 2 abutments on this side of the pontic. That is perfectly okay to do, especially in an implant, a retained type of a bridge. That would be perfectly fine to do something like that. For the other types of bridge, we have what would be considered a resin bonded, or also known as a Maryland bridge. And as you can see, this would be the pontic replacing the missing tooth. And instead of having abutments on either side, this has little wing attachments on the side of it, on the mesial and the distal. These little wing attachments can either be metal, or they can also be ceramic or porcelain, just to match the pontic here. So this type of a restoration would be recommended on a patient that maybe would like to eventually have an implant, but right now they maybe can't afford to do it. This kind of gives them that option down the road if they want to do something a little bit differently, as far as not having the traditional bridge, but having an option to remove this at some point and get an implant placed in. Very little preparation is done, just on the lingual surfaces of those, basically those anchor teeth is going to be all that's going to be required. And then this gets bonded into place or cemented into place. And what's nice about this too is it's another option in the event that the teeth that are next to the missing tooth are possibly virgin teeth, meaning that they have no fillings, they have no crowns, nothing has ever been done to them. They're in perfectly good condition. It's very hard to have to remove natural tooth structure and create trauma to a tooth that has never had trauma to it. It's perfectly fine. So again, this kind of gives another option to doing a full traditional bridge where we're having to prepare those teeth down and take away a lot of this tooth structure when they were perfectly good teeth with nothing wrong with them. Another type of bridge that we could do is something like a cantilever bridge, and it's very similar to a traditional bridge with the exception of it only has 1 abutment and 1 pontic. So the pontic is actually free floating onto the abutment here. So unlike a traditional bridge, which would also have an abutment here with this pontic attached to it, a cantilever is basically a one pontic, one abutment type of a bridge. Again, this is done for a number of reasons, and it's all going to depend on the condition of the patient's oral health, their tissue, the remainder of the teeth that are present. As we can see in this one, aside from all the bone loss, which this cantilever bridge was more than likely put in when the bone was good, hopefully, this tooth looks perfectly fine. There is no restorations from what we can see. Here we can see that there's been a filling done on this tooth. There's been a filling done on here. This one has a crown. This one has a crown. This has a filling here. This tooth either had a crown previously or it may have had a restoration done, which then allowed them to do this cantilever bridge. Rather than creating trauma and causing damage to this tooth that really didn't need it to do a traditional bridge, in this case, they were able to get by with doing a cantilever. Cantilevers are going to be more ideal for anterior to premolars, and as we can see here, this abutment is going to be the molar, where this pontic that's replacing the missing tooth is going to be a premolar. So in this case, this would be an ideal way for still the patient to replace a missing tooth without having to compromise a perfectly good normal tooth. So these are all the different types of bridges that can be done. Again, it's all going to depend on the patient, and it's going to depend also on the preference of the dentist. Some dentists absolutely do not like cantilever bridges because they're more prone to breaking, because they're not going to be as sturdy as, say, a traditional bridge is. So this may not even be an option for the dentist that you're working for. But just know that there are certain options out there when it comes to the different types of bridges available to patients.